You're listening to Navigating Eldercare, where you'll find guidance and answers for every step of the eldercare journey. Each week, eldercare advocate Laura Daniels brings you expert insights and practical solutions to help families and professionals make confident care decisions.
Hello, my name is Laura Daniels, founder of Care Advocates and your host for Navigating Elder Care. For years, I have been helping families and medical providers, doctors, social workers, nurses find the right solutions for seniors in transition, whether that is after a hospital stay, a rehabilitation stay, or when the care needs at home have changed. We assist in finding the right care options. I started this work because I saw how overwhelming and confusing the elder care process can be, and I wanted to be that guide and resource for families and professionals. In my business and in my work at Care Advocates, we walk alongside families every step of the way. We meet with our families, clients, and providers to create a customized care plan. When care needs have changed and someone is needing assistance with mobility, dressing, transfers, we provide options such as residential care homes, assisted living communities, memory care communities, or Medicare-covered resources such as hospice that can come into the home and support families. The care journey should never feel overwhelming. It should feel guided, supported, and understood. And welcome back to Navigating Elder Care. I am your host, Laura Daniels, and in today's episode, we are going to be talking about hospice care. What is hospice? And my guest today is Monica Trust, Chief Executive Officer at Guiding Light Hospice, who assists families and healthcare providers to truly understand what hospice is and what a meaningful difference it can be in the quality of someone's life. Monica, I thank you for being here.
Thank you for having me, Laura.
Monica, we're going to talk about hospice care, such an important topic. For listeners who may not know, what is exactly hospice? How would you define hospice?
So hospice care focuses on quality of life when a cure is no longer possible or the burdens of treatment outweigh the benefits. When a patient is diagnosed with a serious illness that is now become terminal, treatment is not helping. That is when we are called in to come in and educate the family on what are the next steps and what that will look like.
In last week's show, we talked about palliative care extensively, and if for those that have not heard that show, I encourage you to go back and listen to that podcast talking about palliative care, which is a step before hospice care. Correct, Monica. So how is hospice care different from palliative care?
So palliative care focuses on easing pain and discomfort, reducing stress, and helping patients have the highest quality of life possible while they're going through their treatment, and helping the family to be proactive and plan ahead.
Do you find that most people sign up for hospice kind of late? Is that what is your experience?
Yes.
With that?
So
okay.
we find that families, patients, they're afraid. They want to continue the good fight. But what we find very often is that they are not referred to us early. And what happens is just a journey of just suffering. Yes. Suffering that breaks our heart as we join the family on their journey and we start to walk alongside them. And I wish they would have told us sooner. Yeah. Because being in and out of the hospital, as we are raised, that when you go to the hospital, they're going to help you. Yes, that is true. But also going in and out of the hospital, discharge, admitted, that is not living. That is not quality. And this is where we come in and help distinguish that and explain what that looks like. It's not wrong, but it's also not right.
Yeah, and it doesn't mean you have to do hospice right away. You can do palliative care first, right? And, Monica, in the work I do, I've been a registered nurse for 33 years, working with older adults. I see that statistically, right, we see that patients live longer when they're on hospice. They have quality of life, they have the advocacy, the education, the support?
Sometimes, depending on the diagnosis, but patients do live a better quality of life, and they are with us a little longer,
right,
because we are aggressively paying attention and focused on their symptoms of their disease. Very important. Let's talk about President Carter. He was on hospice for a while, longer than the expected, or what Medicare says, 9 months, 6 months or less, I apologize, 6 months or less of a patient being on hospice, that they've got 6 months or less to live. The benefit may be extended multiple times, like with President Carter, if the physician certifies that the patient is appropriate. And everyone saw President Carter as he laid his beautiful wife to rest. They brought him out in a gurney. That was a hospice nurse. He was not in good shape, but his quality of life was better, and he was able to make it to the service, even if to the naked eye he did not look well.
That's a great
but
example.
that's hospice.
Give us some of the symptoms that you manage. You talked earlier about you symptom manage. So to talk about that.
So we symptom manage nausea, vomiting, the no eating, dehydration, anxiety, fear. You know, there are, when a patient comes onto hospice, there are different types of pain, not just the physical, the emotional pain, the spiritual pain of the questions that a patient will have, that a family member will have. Well, what happens when my loved one passes? Where do they go? Those are serious questions that then our team comes in to help the patient and the family navigate.
Monica, let's talk about, when is hospice appropriate? What signs or symptoms tell us that it may be time to consider hospice?
Again, when the curative treatment is no longer possible because the treatment outweighs the benefits, where we're now in a stage where we're not helping, but we're probably causing more suffering.
Okay.
With treatment.
And Monica, who actually decides if someone qualifies for hospice?
So it's a combination. There are guidelines that we follow. A physician will send over a referral, talk with the family. We come in and then we review the patient's history, what's been going on, and from there we determine, we go out and do an assessment to see if the patient qualifies for our services.
And if they don't, they may qualify for palliative, correct? Okay. Can someone receive hospice care even if they live in an assisted living, in a residential care home, or in their own home?
We can provide hospice care in a variety of environments. Home, we have provided care in a hotel off of 35. A young patient was diagnosed, went into the ER, and had cancer stage 4. It was in the brain, and was working here. And that's where he was living because he traveled. We provided care there, and then we were able to move him to a skilled nursing facility. It can be done anywhere. Hospice can be done in a hospital as well.
Monica, I'm going to back up a little bit, and I want our listeners to hear a little bit about you, your background, and your role at Guiding Light, and what inspired you to work in the hospice space.
So I was inspired many, many years ago. I'm from deep South Texas, and my grandmother was diagnosed with stage 4 lung cancer. And there was a full year of, now that I'm educated in this realm, of decline. And my mom trying to find answers. And I found that she was not prepared. We were not prepared. I kept referring to my mom, well, Mom, what does the doctor say? Well, unfortunately, the doctor in this situation did not believe in hospice care, and it wasn't her old age. It was my grandmother was declining with cancer, and she passed. She discharged on a Friday, and she passed on a Wednesday. What caught my attention was that when the woman walked in with the plan and support and answered our questions, I thought to myself, wow, what a neat job is what I thought. What a fulfilling job to help families navigate. Well, when my grandmother passed, I felt, why was that so quick?
How long was she on hospice, Monica?
Friday, she was discharged and admitted, and that next Wednesday.
Oh, my gosh.
So what happens in that situation is that families are left with a lot of questions, a lot of unanswered questions. An opportunity is missed to not be able to say goodbye either. I saw my mom and my aunts and uncles, her siblings, suffer through that. And that was very disheartening. So then comes my mom, who was diagnosed with cancer, and her journey was very different. As we had the conversation, we were able to say goodbye. Although she was 61 years old, very young, being connected to the right resources, my mother was able to have 9 more months of life, which I emphasize to families. Reach out to your physicians, talk to them, go see the doctor, be proactive, don't be reactive. Because then what can happen is you're in a situation where you don't have much choices for treatment because it's too late.
And in your grandmother's situation, you missed out on all the wonderful advocacy, education, support, bereavement support that comes with hospice.
Yes. It was so quick. Bereavement, we provide bereavement 13 months after a family member has passed. But when, like my grandmother, that was such a short period of time that I saw my mother suffer that depressive disorder in their studies, that a longer a patient is on hospice, the family will be better equipped when their loved one is no longer there. Then with me, of course, losing a loved one is very, very sad and it's very heartbreaking, but I was better equipped than my mother was. It still hurts. It's still very sad, but the team prepared me for what was going to happen next.
Okay. And you're in the space, so you knew what to ask, right? So for those families that don't know what to ask, you will be their support, their guide.
We will be their voice.
Okay.
And our nurses, our team is trained to recognize sometimes a family will say a certain word that will trigger a conversation that they're afraid. Okay, let's talk about that. What does that look like? Why are you afraid? It's a lot of talking, a lot of listening. Yes, we manage the physical symptoms of pain and what comes along with the disease, but we also listen, and we are the big brother, the big sister that they can lean on during a time of a roller coaster of fear and emotions.
I'm so sorry about your mom.
Thank you.
So young. I want you to share a little bit about bereavement, right? You talked about it in the last episode with Palliative Care. That wonderful story you gave me about the young couple, about the young lady. Can you tell us about the bereavement process?
So our bereavement program follows a patient and the family, follows the family after the patient has passed for 13 months. That comes along with phone calls, visits, helping the family navigate. We have a variety of support through loss of life advocates that help come in to help the family close out accounts, to educate families.
Another wonderful service. We're going to have Esther Pibbley, loss of life advocates, on the podcast.
Oh, yes. She's amazing. And our bereavement coordinator connects the family on how to do that, because families, how do you close it out?
Another resource.
Another
right?
resource.
Yes.
The resources are very important, very, very important.
Monica, let's talk about the Guiding Light Hospice team. Who makes up the hospice team, and what does each role do for a family? From your nurse to your social worker to your CNAs, physicians.
So our physicians are there to oversight to make sure that the plan of care is appropriate with the nurse. We have the social worker who is there for resources and to provide support for the psychosocial pain and questions that a patient and family has. The chaplain for those spiritual questions and support that families need. We'll connect them with their parish, reconnect them with their parish, with their church. Because of the disease, they've not been able to do so, is what we do. Our CNA that goes in to help with personal hygiene and helping train the family how to move the patient, along with the nurse. And then we have our volunteer department. We have a phenomenal program that's our caregiver relief program. We go in and always pay attention to not just the patient, but the caregiver. If they're burned out and they're exhausted, we are here to provide that support for them as well. We meet every 14 to 15 days, and we discuss the plan of care and adjust accordingly. We also have our Veterans Liaison that comes in and helps our patients and families tap into benefits, working with our social worker as well.
And if they are on hospice care with Guiding Light and the family has a question at 7 p.m., who answers that phone? And can they call after hours?
They can call after hours, 7 at night, 10 o'clock at night, 2 in the morning, and a nurse will always answer the phone. We pride ourselves in that. We give a report out every day at 5 o'clock, and if anything that's gone on, and we are proactive in giving our on-call team that information that patient Smith may need additional support and they may be calling. That's very important.
Monica, when someone calls you for hospice care, onboarding, or even if they qualify for hospice care, what does that first visit look like?
So the first visit...
And who does the first visit?
The first visit is our admission nurse, right? By the time that our admission nurse goes there, we have spoken with the physician, we've spoken with whoever referred that patient over, we have reviewed their clinical information history. We already have a very good understanding. We have spoken with the family. We go out, and the patient is, if they're able, they're asked questions, the family, and a head-to-toe assessment is done. And then the nurse may step away and call the physician and report everything that has been discussed and where the patient is, and a plan of care is starting to form at that first visit.
Monica, what support does hospice provide for families, not just patients? And you talked a little bit about some of the support, the bereavement, but what other support does hospice provide?
So if a patient has become where their symptoms are not being able to be managed appropriately, the caregiver is burned out, we provide, respite care, which is 5 days. We also provide the caregiver relief. We also have palliative massage, which is a holistic approach. Sometimes the human touch works way better than medication. Music. We teach the family what to do in certain situations with supporting their loved one at home, because most patients want to be at home. They don't want to go anywhere else. Yeah.
And you have your volunteer program, your VA.
Yes, our Veterans Liaison, again, able to tap into benefits. If, like myself, my husband is retired, and I have seen the good work of our Veterans Liaison where he has tapped into benefits, because now the person or the patient that we're caring for was the spouse of a veteran, and he or she is entitled to benefits through the VA, and their spouse, who was a veteran, has deceased. He's able to. We're still able to tap into that. And Daniel Schumann is a phenomenal advocate for his veterans. He is also a veteran himself.
Monica, can you explain the equipment, supplies that hospice provides?
Depending on the need of the patient, but basic equipment is a bed so that the patient, we can lift the patient, rise, the bed will rise, go down. It's an electric bed. We offer oxygen, medications will be delivered to the home. Things like gloves, wipes, things like that. Whatever the patient needs to be comfortable at home. Briefs. We offer wound care supplies if needed. Foley catheters. Just a variety of things depending, again, on the need and the prognosis of the patient.
We talked about this a little bit earlier, but this is so important to me as a nurse. Monica, what symptoms does hospice help manage? Is it also, agitation, anxiety, pain?
All of it. All of it. Add the emotional, the spiritual, but the symptoms of end of life, pain, constipation, if the patient is having trouble breathing, they develop a wound. Right. All those things is what we manage. Nausea, vomiting. There's a lot that happens as the body starts to shut down. things can get complicated, but with education and helping the family understand that this may happen, again, we always take the proactive approach.
Let's talk about common fears and myths. Many families fear hospice. As you know, it means that they're giving up, that their loved one is dying. How do you explain to a family what hospice really means?
I tell families, we are not giving up. We're still fighting, but our focus has changed. Our focus has changed to fighting for quality of life, going in and out of the hospital, being poked, one more treatment with the symptoms of the nausea, the vomiting, the chills, and not eating, the confusion. That is not living. That is not quality living. And again, when we have these conversations, they're done compassionately. We will not push anything. The family is still in control. All that we're doing is educating.
Monica, is someone able to improve and graduate from hospice?
Some patients are able to then go from hospice to palliative care, and where they are in a much better position. It doesn't always happen, but it does happen. It can happen.
I want you to give me that one story, that one moment that reminds you of why you do hospice. Why do you do the work you do? And do it so well, by the way.
Thank you. Yeah. I had another young mom, and she had 3 young adults, 19, 20, and they were helping take care of their mother, and she was a sole provider, and they had lost their jobs. I went in to talk to her, and she wanted to go home. I spoke with the children, and they were unsure of what to do. I explained to them and the connection I had with them. I was and had been in their shoes. And they were tired of being in the hospital. So we got her home, and I sat there and helped to fill out paperwork for these young 19, 20 years old. Think about it. Would your 19-year-old know what to do? No. They don't. I sat there, and I didn't just hand them a document. Our social worker just didn't hand them the document. It was all hands on deck. We went through the paperwork so their lights wouldn't get turned off, so they didn't lose food. We were connected them with the food bank, connected them with every resource. And what were they going to do after? Were they going to look for work? What was the situation with the home like? We dig deep into help these families. I've had families where it's just one child. Yeah. They don't have anybody. So we become that extension and their support.
Whether they're 19 or 70, most people don't know what to do or where to go. And you're just so much more than just palliative care and hospice care at Guiding Light. You are a true resource.
Absolutely.
For everyone.
If we cannot meet the needs of a patient or a family, we will absolutely find who else can help support us so that we can make sure that they get what they need.
Yeah. And Monica, in the work I do in placement, many people wait until the last minute to call and ask me for help to place someone in assisted living. They usually wait for a hip fracture or a fall or a mom walked out the door with dementia. So I don't want our listeners to go through what you went through with your grandmother, right? If there are questions, if they have doubts, if they need a resource, where can our listeners go to learn more about Guiding Light and hospice? How can they connect with your team?
Call us at our office at 210-585-2335. Valerie is our intake coordinator, and she's a nurse. And she can answer those questions. Look at our website at www.guidinghospice.com. Our Facebook, our Instagram. Reach out to us. We're here to support the community.
Monica, I thank you for being here today talking about hospice. Your compassion and clarity truly helps families understand the power of hospice and how important that can be. And I thank you for joining me on Navigating Eldercare, where we bring guidance and answers to every step of the elder care journey. If you are a family member, hospital case manager, or healthcare provider, and you know someone facing a change in health or planning for a future care need, Care Advocates is here to help you find the right care at the right time, whether that is assisted living, memory care, or bringing trusted resources such as palliative care, hospice care, into your home. We walk alongside you every step of the way. Our commitment is simple: care, compassion, lifetime support. For a free consultation, call me, Laura Daniels, at 210-669-2222. You can also listen to past episodes on YouTube or listen on your favorite podcast application. I am Laura Daniels, and this has been Navigating Eldercare, helping you find the right care at the right time for people that matter the most.
This has been Navigating Eldercare with Laura Daniels, providing guidance and answers for every step of the eldercare journey. For a free consultation, call 210-669-2222 or email laura@advocatern.com. Catch every episode on 9:30 a.m. The Answer, YouTube, your favorite podcast app, or at advocatern.com.